Everyone is guilty of it. While you are getting ready in front of a mirror, you notice a red pimple that is looking back at you from the middle of your face. It is a problem that you cannot ignore. A moment of twisted satisfaction comes over you, and your fingers yearn to pop it, to make it disappear in an instant. What if, however, that seemingly little and almost instinctual action turned out to be a serious medical emergency? How would you feel if you discovered that popping a single pimple in the wrong spot might transport bacteria directly to your brain? This is not merely a superficial problem, even though it comes across as scary. There is a real risk that has been brought to the attention of medical professionals all around the world, and it is all related to a very small area of your face that is extremely dangerous and is referred to as the triangle of death. What exactly is the triangle of death, and what exactly is the silent danger zone? However, even though the phrase triangle of death may sound like an urban legend or an overblown kind of clickbait, it is based on medical facts. This area of your face is characterized by the space that exists between the corners of your mouth and the bridge of your nose. This area results in the formation of a triangle that encompasses the upper lip, the nose, and the space in between. It is one of the most vascular parts of the body, and it is crisscrossed by a large number of veins that are directly related to deeper tissues within your skull. In contrast to veins in other parts of your body, which have valves that prevent backflow in one direction, the veins in this area of your face do not have valves. This is what makes it risky. This particular anatomical element can appear to be insignificant, yet it is quite significant. Specifically, it indicates that bacteria that originate from a popped pimple or skin infection in this area can move in both directions, particularly upward. And to what specific destination do these veins on the face lead? The cavernous sinus, which is a big vein located at the base of your brain, is the destination of this vein. How a straightforward squeeze can transform into a crisis. When you burst a pimple, you are causing the skin to rupture almost immediately. You might believe that you are cleaning it out, but in reality, what you are doing is pushing bacteria and debris deeper into the tissue that surrounds you, and possibly even into your circulation. When it comes to the triangle of death, where veins provide a direct route to the brain, this is an exceptionally dangerous situation. Bacteria, once they have entered the bloodstream, have the potential to enter the cavernous sinus and begin infecting the tissues that are located in the surrounding area. This results in a condition known as cavernous sinus thrombosis, which is extremely frightening even though it is extremely uncommon. A persistent headache, swelling near the eyes, and a low-grade fever are some of the symptoms that may emerge at the beginning. To the majority of people, these symptoms are not even somewhat connected to a pimple that they popped a few days earlier. On the other hand, as the infection becomes more severe, it may swiftly progress. The patient may begin to suffer difficulties in moving their eyes, difficulties in seeing well, or significant pain behind their eyes. In its most severe manifestations, the infection can result in the formation of blood clots, enlargement of the brain, seizures, coma, and even death. A danger that is not worth sustaining. The straightforward reality is that no acne is worth your life. No imperfection is worth putting one's brain at risk for, regardless of how red, bloated, or aggravating it may be. There is no such thing as a myth. The triangle of death is a medical reality that has its origins in your body. In addition, you are required to roll the dice each time you choose, squeeze, or pop in this zone. The fact that this could have been avoided altogether is what makes it an even more tragic incident. You can allow your body to recover in the way that is best for it if you have some patience. Take care of your skin properly and exercise self-control. Do not rely on your fingernails and a bathroom mirror to resolve a blemish if you are actually concerned about how it appears or how it feels. Instead, seek the assistance of a professional. As a result of the fact that the repercussions, in extremely rare but known instances, are significantly more severe than a scar, they may be irreparable. You never know who might be one pop away from danger, so if you found this to be relevant or eye-opening, don't forget to like, comment, and share it with others.